Hello, and thank you for joining us today. I'm Mrinal Kanti Chatterjee, Assistant Marketing Manager at cloudlens.com. I'm excited to moderate this event today. In the next 30 minutes, our speaker Martha Hernandez will discuss current and upcoming tests in the lab diagnosis of monkeypox virus. Before beginning her professional career as a scientist with us, Martha spent 12 years working as an analytical chemist in various industries, from clinical diagnostics to forensics in Mexico. Martha loves to attend trade shows as she gets the opportunity to meet and interact with new people and thought leaders from different industries. Getting the job done in less time is a priority for her personally, as there was a time when she would spend over 14 hours per day manually filling in the logs and typing the results, wasting her valuable time and making mistakes due to exhaustion. When Martha is not traveling for work, she loves to dance and play with her pups, Homer and Benito. Martha loves to pose with her pups and share pics on her social media accounts. Before we get started, I would like to go over a few points so that you know how to participate in today's webinar. All attendees will be in mute mode throughout this webinar. This is an interactive webinar, so we encourage you to ask questions anytime during the presentation by entering them in the chat box. The questions will be answered during the Q&A session at the end of today's presentation. We'll take as many questions as time permits. We do want to keep today's presentation on time. So if you're unable to answer your questions today, we'll answer them by email. Now let's welcome Martha Hernandez.
Hello, I'm Martha Hernandez, and today I'm going to talk to you about laboratory diagnosis of monkeypox virus, the current and the upcoming tests. So, in this talk, we will get an overview of the monkeypox virus and its characteristics from the current outbreak. We will review the latest guidelines and recommendations for testing. And also, we will discuss how a powerful IT tool can help streamline and automate operations in clinical diagnostic laboratories. But first, let's see what monkeypox is. So, monkeypox is an emerging zoonotic disease. A zoonosis is a disease that is transmitted from animals to humans. This infection is caused by the monkeypox virus. The monkeypox virus is classified as an orthopox virus and is a DNA virus as well. This monkeypox virus is transmitted to humans as a result of close contact with infected animals like squirrels, some rats, different species of monkeys, of course, and other infected humans. So the human-to-human transmission is limited, and the longest chain of transmission is reported to be by 6 generations. This means that it's contagious, yes, but it's less contagious than other viruses, such as coronavirus, for example. It can be transmitted through contact with body fluids, skin lesions, or internal mucosal surfaces, such as in the mouth or in the throat, or the respiratory droplets and contaminated objects. So the monkeypox has an incubation period of 7 to 14 days and causes symptoms similar to those of the smallpox, but much less severe, such as fever, headache, fatigue, myalgia, general body aches, swollen lymph nodes, and the most characteristical, the skin lesions. So in 2022, the World Health Organization declared the current monkeypox outbreak a public health emergency of international concern. There are cases in more than 75 countries, and the cases continue rising every day. So it can be difficult to distinguish monkeypox based on clinical symptoms alone, especially in cases with an atypical appearance, because there are a number of conditions that cause these skin rashes. And non-specific clinical presentations have been observed in this disease, like lesions and inflammation of the pharyngeal mucosa. So these symptoms can be seen in many other viral and no viral infection. So for these reasons, the accurate laboratory diagnosis of the disease is of particular importance. That's why the laboratory diagnosis is the MVP here. Without them, we cannot do anything to diagnose this disease. So under current guidelines, the testing should be offered to anyone who falls with the definition of a suspected case of monkeypox infection. Samples from anyone suspected of having monkeypox should be tested in properly equipped laboratories by personnel trained in the relevant safety procedures. The monkeypox, is a disease that presents challenges for the public health and the health workers in terms of surveillance and laboratory capacities. So, the confirmation of monkeypox virus infection is based on the nucleic acid amplification test, the NAAT, using conventional or real-time polymerase chain reaction, or the very famous PCR, for the detection of the viral DNA. So this PCR can be used alone or with a sequencing for foolproof confirmation. The antigen and the antibody detection methods do not distinguish between orthopox viruses, and therefore they're not recommended for this disease. The National Institutes of Health, the NIH, the CDC, as well as different health organizations such as the Health Security Agency of the United Kingdom and some other around the world, recommend that the health departments of each location ensure the timely identification of suspected cases, the timely collection of samples, storage, transportation, testing, and reporting in the public health laboratories. Also, the implementation of security protocols. There are some biosafety measures that the laboratories must follow. Some of these recommendations are that the test must be carried out in properly equipped laboratories and biological safety level 2 as minimum, by the personnel trained in the relevant technical and safety procedures for this manipulation of the samples. Also, the measures should be taken to minimize the risk of laboratory transmission by conducting a risk assessment when testing routine clinical specimens from patients with confirmed or suspected monkeypox. There are some other biosafety considerations for the clinical laboratories. For example, appropriate standard operating procedures or SOPs must be established, and laboratory staff must be trained in the proper use of personal protective equipment, the PPE. And this personal protective equipment should be provided from the laboratory to their staff, and they have to show them how to use it. For example, the gloves, the mask, the coats, and all this equipment that is protective for the staff to minimize the transmissions of the monkeypox virus. And of course, they have to minimize the risk of transmissions, and the staff testing samples should be competent staff only. They have to rigorously enforce standard precautions. The laboratory must use effective disinfectants, and they have to manipulating these biological specimens in biosafety level 2 as minimum. When they have to extract the DNA or whatever the procedures they're using, they have to be on laboratories in biosafety level 2. So if a centrifuge is required for a procedure, a centrifuge is required for any procedure, the safety cups or seal rotors should be used for it. So they have to use this centrifuge properly. let's see what are the recommendations for sample collections. They're kind of simple, but they're really important to follow. So they have to wipe the lesions with sterile synthetic swabs. They have to collect two lesions of the same type in the single tube from different places of the body and of different appearance. And the staff can use dried swabs or swabs in viral transport media, the VTM. They can use this, but no the bacteria media, of course not, because we will have a cocktail of bacteria in our samples, only the viral transport media. And the staff must remove the gloves and wash their hands to avoid any cross-contamination. For the storage, sample storage, well, store specimens in a sterile leak-proof container is recommended. And they recommend also to identify the specimen with using two identifiers and specimen information that can be used. They can be used, I don't know, the patient name, the patient date of birth, the patient gender, or a unique ID that could be a barcode, for example. Also, the lab should perform a risk assessment before using any pneumatic tube system to transport the suspected or confirmed monkeypox samples. These are very useful for the hospitals, for big laboratories, for example. And the monkeypox specimens should be refrigerated at a temperature of 2 to 8 degrees Celsius as soon as it has been collected. And if the test is conducted more than 7 days later, the specimen should be frozen at a temperature of minus 20 degrees Celsius or lower. So, according to current guidelines, the sample should be stored, refrigerated, or frozen within 1 hour of collection and transported to the laboratory as soon as possible. The facilities must ensure that all the personnel are trained in specimen handling and spill decontamination procedures. Of course, we don't want that any accident happens, but the staff must be ready for it. All specimens being transported should have appropriate triple packaging, proper labeling, patient history form, coolers, and cold packs or dry ice, for example. So, speaking about testing, well, several diagnostic tests were performed from previous outbreaks of monkeypox in the past. For example, the LAMP method. This is the loop-mediated isothermal amplification. These isothermal amplification methods do not depend on the thermocyclers and reduce diagnostic costs. However, these methods have certain limitations in terms of selectivity and ease of operation. But there are some laboratories that they cannot afford these very expensive thermocyclers to perform all these DNA tests that are still using these isothermal amplification methods. So that can be useful as well. The other one is the microarray. This method allows discriminating between different species of human artipox virus and herpes virus. It can be used for the identification of gene subsets responsible for difference in pathogenesis and virulence, which may help to gain insights into microbial evolution and genome heterogeneity. So I think this is more for research, maybe. So there's another one, and is the fluorescence resonance energy transfers. This real-time PCR assay can detect and differentiate between human pathogenic artipox viruses. And this another one is the nested multiplex PCR. This is another method that has been used in the past, and this method can be used for viral identification and control of orthopox virus and parapox virus. So these are some of the methods that has been used to detect this monkeypox virus and their relatives. But today, right now, currently, methods that are used for the confirmation of the monkeypox virus infections are based on the nucleic acid amplification test, and they can use conventional or real-time polymerase chain reaction, or the PCR, for the detection of the directly of the viral DNA. And the DNA can be extracted from samples using any validated standard extraction protocol or kit. And this is very important for them because the external, internal, positive, and negative controls are needed to validate the results. So you need to have these controls to validate the results and to be the reliable results in your laboratory. So, a positive case with a PCR test for orthopox virus requires a confirmation of monkeypox virus by another PCR, or if you have a lot of money, well, for sequencing. So, for suspected cases in endemic or non-endemic areas, a positive case with PCR for monkeypox virus, well, provides a confirmation for monkeypox virus. And in this case, well, the genetic sequence data, or GSD, provide information on the origin, on epidemic, and the characteristic of the cases. So sometimes it's really useful for research purposes. In reporting, well, due to the public risk of health associated with a single case of monkeypox, the established protocol is that the clinician should immediately report suspected cases to the state and federal health authorities. And also to any confirmed case should be reported to the National Institutes of Health. So the test data and results are crucial in a pandemic. We have learned this in recent years. The timely numbers can help predict the increases in demand for tests and plan for potential problems in the supply chain of reagents and other testing materials like kits or whatever. So, all laboratories that perform diagnostic tests for monkeypox must report the results to the state, tribal, local, or territorial health departments. As a result, all the results must be reported, the positive, the negative, the ones that you will repeat it. This has to be reported unless otherwise specified by the health department. And the positive results should be reported within 24 hours of testing, or if it's possible, immediately by phone to the appropriate health department. So there are other recommendations for waste management, and they're very similar to any biological waste management. So the sharp should be disposed in appropriate containers for autoclaving as infection waste. All the monkeypox virus cultures, stock, residual samples, and waste should be decontaminated before disposal by an approved method. And the most used is autoclaving, for example. The decontaminated materials must be placed in a durable, leak-proof container and closed for transfer from the laboratory. So, we'll see all these recommendations, we'll see all these guidelines, and well, that's a lot, considering the volume of samples that labs are receiving and that will be receiving this year. So the staff must be prepared, and we have something to minimize this challenge. We have a powerful tool such as LIMS. This can minimize these challenges. How? Well, and LIMS can help you to manage patient data, also to manage different types of test methods. LIMS generate custom reports, manage calibration and maintain its data of instruments. LIMS also report the monkeypox test results following any FDA, any CDC reporting guidelines, and deliver the test results securely and digitally. Let's see how. So, LIMS securely manage the patient data. How? Well, LIMS anonymize the sensitive participant or patient data and assigns role-based protect health information access rights to the staff. So this masked data can be viewed only by authorized personnel. And each time an authorized person views or makes any change on this, this information, the activity is recorded in the audit trail. So this is really useful for audits because sometimes external auditors can request a PHI audit report at any time. So your LIMS will do it automatically for you. You don't have to worry about that, anyone can time travel, change data, change dates, change hours, or whatever. No. LIMS do it all automatically for you. So there are not time traveling issues here. Also, LIMS helps you to manage your diagnostic test. So you can select the type of test that your laboratory performs. For example, if your laboratory has these thermocyclers, well, PCR. Or if your lab doesn't have these thermocycles, well, LAMP. Or if you're in research purposes, you can select a microarray. Or wherever the diagnostic tests are using, you can do it here in your LIMS. You can manage it here in your LIMS. Also, a LIMS helps you to generate custom reports, having any information you want. It could be the provided information, your patient data, the sample information, test results. You can put also the signature of your provider or your logo or whatever you want. A LIMS will do it for you as you wish it because it's completely custom. Also, you can schedule instrument calibration and manage your maintenance data of your instruments. There is a built-in alert system that will inform the lab managers a preset number of days ahead of any needed maintenance or calibration. We know that in laboratory we have a lot of instruments, and sometimes the lab managers cannot hang on all of them at the same time. So LIMS helps them to, tell them, okay, in 3 days your calibration will be, you will need a calibration in 3 days. So lab manager can call the technician and schedule the calibration or maintenance. So always your instruments will be up to date with their calibration and maintenance. So they will be function very well whole year. And also, you can securely deliver test reports to patient via a secure patient portal. So your patients will have their portal and, they are sick, they're home. They want to know the results. They don't want to have any contact with any human, of course, because they are isolated. So they can access the internet on their phone, on their computer, so they can check their own portal and check the results there. So it's really cool for them. And similarly, you can securely deliver the test reports to physicians via a secure physician provider portal. So the provider can access wherever he is and check all the results of their patients. So it's really cool. And also, LIMS can help you to reorder the test, or you can use it for the next test in the infection detection hierarchy. If you need to repeat one, or if you need to have a sequencing or any other test that you have to do for the same sample or for the same patient, well, you can do it here on your LIMS. So in conclusion, you have seen all the benefits to have a LIMS, and it increases the efficiency, eliminated human error because all is automatically, and is digitization. It's the key here with the LIMS. Improves the data quality and therefore boosts the validity and reliability of monkeypox test results in your laboratory. So thank you very much for your attention.
Thank you, Martha, for the insightful presentation. I request all attendees to please take a moment to fill out the survey that you see on your screen. We are now going to begin answering questions. As a reminder, you can still submit your questions through the chat box. We have some interesting questions, so I'll move straight on to these. The first question is there currently a vaccine against Mpox? Of course, monkeypox is now known as Mpox after recommendation by the World Health Organization.
Exactly, Renaud. Yes, we have an option. Well, two options for vaccine. The first one is a two-dose vaccine. It's called is Genius. It's for Mpox, as you said. And the other one, it's the ACAM 2000. This is a single-dose vaccine as well. But, well, according to the CDC guidelines, the only people that is eligible for vaccination are those who have been in close contact with someone who has tested positive for monkeypox, for Mpox. This is because the vaccine supplies are still insufficient for high-risk population. But the short answer will be yes, we have a vaccine.
Great. So the next question is, when is an infected person no longer contagious?
Well, um, there is not like a time for it because the immune system is highly variable between individuals. So the recovery time varies from person to person. However, the CDC says that the person with Mpox can spread the infection to others until after all the scabs of the skin have fallen off and a fresh layer of intact skin has formed.
Thank you, Martha. The third question is, how many physicians and patients can access the physician and patient portal respectively at the same time? This is a lovely question. We keep receiving this question from our customers as well.
Yes, good question. Yes, and this is a very, very common question. Well, it depends on the limbs vendor, of course, but generally there is not such limitation in that. There are multiple physicians or patients and can log into their accounts on their respective portals at the same time. But for example, CloudLimbs allows these laboratories to add unlimited patient and physician records so that they can access the patient and physician portal respectively, without any restrictions. So this is really cool. I have to say, it's really cool for patients and for physicians to have this access to their records from their homes or wherever they are.
Thank you, Martha. Attendees, you can still post your questions. I see several attendees. So if you have any questions in mind, it's time to post your questions. So the next question is from a lab manager of a clinical diagnostic lab. The question is, I constantly look for ways to reduce the turnaround time at my clinical diagnostic lab. I'm sure all lab managers try to find such ways. Can a LIMS help me generate and batch release test reports?
Well, I totally understand. We always want to reduce time and increase efficiency in our laboratories. So, in this case, LMS helps tremendously to achieve this. Of course, you can generate and release a batch of test reports to physicians and patients at the same time. And this is really helpful because eliminate any human error so that you as a laboratory manager can make better use of your time. So yes, it's totally possible with the LIMS.
Yes, I agree with you, Martha. So, attendees, you can still post your questions. Let's wait for a couple of minutes because we have some time. So, Martha, do you think that monkeypox may become a pandemic like the COVID?
Well, I don't think so, and I have seen a lot of of literature that they're talking about that it's not that possible because of the spread of the virus is less than the coronavirus. So um, as huge as a pandemic, I don't think so, but a public health concern, yes, totally. So we need to be, we need to be prepared for anything where that can happen. But I don't think that a huge pandemic as coronavirus as well because of that.
I agree with you, Martha.
Mhm.
So I don't think that Mpox will become a pandemic like the COVID-19, but
Great.
labs, clinical research labs particularly, should always keep looking for new mutants because virus keeps mutating and you never know when a dangerous virus will come out.
Exactly. So we need to be prepared, and with tools like this, it's very helpful for all the clinical laboratories to get ready for anything that could happen in the future.
Yeah. So I think there are no more questions. So attendees, if you have any questions in mind, you can post now, or you can write to us at support@cloudlimbs.com. We'll get back to you as soon as possible. Thank you, Martha. Thank you, all attendees. Have a great day.
Like
Bye bye.